Hello everyone. Miss Griffin, pleased to see you. Miss Turret, our administrator. Miss Kelb, our speech language pathologist. Miss Compton, our school psychologist. And most cordially, Mr. and Mrs. Thomas and our lovely third grader, Susie Thomas. Susie, I'm so glad you're here with Mom and Dad today. I think this is so important that you, Mom, and Dad get to help Miss Griffin, Miss Turret, and Miss Kelb and I. So I'm Miss Gasta. I'll still introduce myself, even though I know this is our second big meeting and we all have met once before. If you all are anything like me, you have to hear names 5 or more times while looking at the person's face before you can really memorize someone's name. I get the privilege of leading this very important determination meeting where we are about to go over all those big tests you took, Susie, and you did such an amazing job and you put so much hard work into those. Mom and Dad, good job getting Susie excited about taking all those tests and helping her get ready to do her best. Also, we're going to talk about our impression, or what we think, of all the information we gathered from these results, and together we're going to assemble all these puzzle pieces. As you listen to all of this, Mr. and Mrs. Thomas, please stop me at any time with any questions. As I like to tell all my families, I welcome friendly interruptions when it comes to making sure your expertise and your knowledge being made a part of your child's case. So Miss Compton, our amazing school psychologist who is right over there, has a bad cold today and she needs to save her voice. So she's delegated me to start for her by first naming off each test Susie took and then second, explaining what the results of each one was. So let's begin there. Susie was given a total of 4 assessments or tests. These are the ones that we discussed at meeting number 1 and you agreed and gave us permission to perform those. These 4 tests are in addition to 3 classroom observations and multiple work samples of Susie's being analyzed. We also paired that with what you reported you've noticed over the years and at home, the impact her teen neighbor tutoring has had at home, as well as with what we've noticed and done at school, such as results from targeted interventions in reading, what we call RTI, which is just small group teaching as an alternative way of teaching her in the regular classroom. That special summer program she participated in through the district to improve reading school skills, and then the peer tutoring she's done in the classroom. So we make sure that we take a lot of information or data and piece it together before we tell you what we think your child may have or how we think we can best help her here at school. We never take this lightly, and we always make sure all of the data agree. So everything we tell you today is based off of evidence and careful planning. We want to assure you that we do not make assumptions. Let me tell you a little bit more about these bigger tests that are pretty important, or the assessments as we call them. I just typed up the names of these so you can follow along on that paper there while I tell you exactly what each one checks for. The first is the Wechsler Intelligence Scale for Children. We just call that the WISC-V for short, the V standing for 5th edition. We consider this a gold standard, or just a highly reliable, universally accepted way to test that's available. WISC-V measures cognitive strengths through 5 domains and intellectual ability. Those 5 cognitive strengths are verbal comprehension, visual spatial, like solving puzzles and completing block designs, fluid reasoning, checking for working memory, and her processing speed. The second is the Woodcock-Johnson, and we just call this the WJIV for short, the IV standing for 4th edition. Susie took both the standard and extended batteries of that. This can get super lengthy if we point out every single one. Plus, we will dive into more detail about her results across the domains in just a moment. So real quick, the standard battery has 11 tests that check for how she applies reading, writing, and math, how fluently she reads, and just overall basic skills. The extended battery looks for her academic knowledge, and that just means we're going in depth as to what Susie knows about science, the humanities, social studies, and how she would spell sounds she hears. The third is the test of auditory and perceptual skills, and we just call this TAPS. WISC-V and WJIV were done by Miss Compton, our school psychologist, but TAPS 4 was done by Miss Kelb, our speech language pathologist who works here at Cactus Elementary School. It measures auditory perception, And really all that means is we want to know how Susie is taking what she hears and then understanding that and then breaking that down into meaningful information that she can then do something with. This test took a little less than an hour, and it's a bit more interactive because you get to listen for things and distinguish between sounds, distinguish things that you hear. So there's 11 subtests, but again, we're going to summarize the bigger picture of those. And really the three main categories are phonological processing, are two words you hear the same or different? Auditory memory, do you remember the order these numbers you just heard were listed in? And listening comprehension, which is listening to directions under quiet conditions, then repeating back what those directions were. The fourth is what we call the Achenbach system of empirically based assessment, and we abbreviate this by ESEBA. And this is just a big psychological test that tells us how Susie functions behaviorally across school and home. The big item we're going off of here from ASEBA is what's called the Teacher's Report Form, or TRF. And this can tell us if there's problem behavior, and if so, up to 8 syndromes that it could be, as well as assess adaptive functioning, which means, like we said, how well Susie can adapt to different settings, and also assess academic performance in addition to tests 1 through 3 a little bit further. This is a good one because myself and Miss Griffin completed checklists since we've known Susie more than 2 months. Mom and Dad, you completed checklists, and then Susie, you got to complete one for yourself. We're looking into categories such as grief and loss, anxiety and mood, any psychosocial function, which just means the psychology of how Susie interacts with peers and teachers socially, given her age and grade. Now, I want to clarify, we totally understand there was no mention of behavioral concerns of any kind from either you, Mom and Dad, or Miss Griffin, or any of the other teachers in the building, or even peers who've tutored Susie. I want to reaffirm that the only reason we did this ASEBA TRF is to make sure there was no hidden or underlying behavioral or depressive symptoms that were silent. This can happen sometimes. If there were, that could end up part of Susie's final determination and selection of interventions we choose. And so while we totally expected test 4 to come back negative, which it did, it's important to note that both IDEA law require us to be thorough in giving Susie the best care, but also ethically as a school special education team, it's personally important to us that we're considering all of Susie's needs and potential needs and not just making assumptions. We want to look at Susie as a whole child, not just her reading skills. Now, let's revisit each of these 4 tests and talk about Susie's results. It's important to note that often our style at these meetings is to talk about categories of performance, which blend chunks of different tests together to make an overall summary a little quicker. However, today, because you clarified that you want to review each test, Mom and Dad, we're going to do that and walk through a report of each test, because here on this team, we consider everyone's wants, and you are 3 of the most important team players sitting here at this table today. So for her WJIB, Susie is on par for her age with math calculation and reasoning. Her general academic knowledge was within expected range for science, social studies, and the humanities. Susie is also on target for a 10-year-old, 5-month-old student in oral comprehension and handwriting ability. Now, let's talk about each category. Susie presents at less than a second grade equivalent in. In reading, she's at grade equivalent 1.9 in the 0.3 percentile. Broad reading, she's considered grade equivalent 1.5, 0.2 percentile. Broad written language, she's considered grade equivalent 1.6 in 0.4 percentile. Basic reading skills, grade equivalent 1.3, 0.3 percentile. Reading rate, grade equivalent 1.5, 0.5 percentile. Reading fluency, grade equivalent 1.2, 0.3 percentile. Reading comprehension, grade equivalent 1.7 in the first percentile. And most significant is phoneme grapheme knowledge, grade equivalent first, 0.2 percentile. I want to pause on phoneme grapheme knowledge and explain how this understanding, I want to pause on this one and explain how this is understanding of how sounds correspond to letters. This is huge because it's a necessary reading foundation. Knowing the sounds each letter makes helps readers decode, which means they recognize and read the words they see, as well as encode, which means they spell words as the sounds are heard. When this specific score is held up to her academic knowledge grade equivalent, 4.3 in the 35th percentile, this tells us quite confidently that Susie learns exceedingly well, but her intake of new knowledge acquisition is hampered by severe reading difficulty at a fundamental level. The older Susie gets, the more text-dependent acquisition of new knowledge becomes. And so this is perhaps the biggest red flag on just the WJIV alone. I don't want to stop there, though. I want to keep going down the line for the WJIV in accordance with your request. Letter word identification, grade equivalent 1.1. The percentile is greater than 0.1. Sentence reading fluency, grade equivalent 2.2, 5th percentile. Let's actually camp here for a moment as well. Sentence reading fluency shows second month of second grade. So she's a little over second grade level here. And while that's less than her current expected grade level, sentence reading fluency is slightly higher than many of the other categories. And what that tells us, again, is that functionally, her brain is ready to process and understands new information presented as is. We can safely argue that it's the process of reading part that hampered the score throughout the capacity to do that she's present and she's very ready to learn. Next, the reading recall is grade equivalent kindergarten and the 2nd percentile. Spelling grade equivalent is kindergarten, 9th month, less than 0.1 percentile. And then let's camp here too. So this specific score is diagnostically significant because it indicates something we call dysgraphia, which just means quite literally difficulty writing when you translate it. Dysgraphia has two components. It can refer to trouble with the motor skills to carry out physical writing, not the part we're concerned about for Susie, but frequent spelling errors, which is like part of the second part. The one that we're thinking of for Susie. Dysgraphia is one of 3 subtypes of specific learning disability, or SLD for short, that we're going to talk about in more detail briefly. I just want to pause and point out at the moment here that the spelling score by itself really flags that, but we're going to pair that to some additionally supportive evidence a bit further down the road here. Moving on. Passages comprehension, grade equivalent 1.5, 2nd percentile. Writing samples, grade equivalent 1.9, 8th percentile. Word attack, grade equivalent 1.6, 5th percentile. Reading vocabulary, grade equivalent 1.9, 7th percentile. And spelling of sounds, less than kindergarten, grade equivalent greater than 0.1 percentile. I link that directly in with the spelling dysgraphia component we just discussed. Now, let's move into Susie's WISC-V, which, as I mentioned earlier, is our gold standard and it's considered effective for identifying possible learning disabilities. This one helps us pin down what we call a pattern of strengths and weaknesses, or PSW, when combined with other factors from other areas. Let's review some key components of her standard scores and corresponding percentile ranks. Verbal comprehension is standard score 85. 17th percentile, low average. Visual spatial standard score 88, 21st percentile, low average. Working memory standard score 68, 2nd percentile, very low. Processing speed standard score 73, 4th percentile, medium borderline range. And full scale IQ 74, 4th percentile, which I would be cautious to take at face value due to the risk of an averaging effect, because there was a big gap between her lowest and highest scores. This indicates that, as has been mentioned in some of our anecdotal data or just reported comments from your family and us teachers, Susie needs extended time to grasp what she's hearing and process. When she's placed in circumstances requiring her to listen rapid fire and then add to that, ask her to write down some things being said, that can cause anxiety and exhaustion. This is in complete correlation with Miss Griffin's comment that it seems like Susie just struggles to keep up with what is normal at this age. I mean, that data ties to that observation, or really more of an interpretation, perfectly. So hold on to that thought as we move into this next test. Now let's look at Susie's TAPS scores. I'm going to start off with the overall impression from this test, which measures how well a student processes what they hear. Susie shows relative weaknesses with isolated words, having a very low auditory word discrimination scaled score, and her relative strength showed to be the opposite, auditory sentence memory from sentences that had meaning. What this tells us is Susie struggles in a fast-paced environment and can easily lose track. It also demonstrates further that reading comprehension, spelling, and phonics are trouble areas, as we saw in WJIV, and also consistent with anecdotal reports from Ms. Griffin. All the other specific areas of forward, reversed, auditory discrimination, thinking and reasoning were low to relatively low. Moving on to the last assessment, the ASCBA with the TRF, that teacher's report form where everyone got some input, mostly about behavior across settings, as briefly mentioned. None of Susie's scores indicated a clinical range for behavioral problems. However, we do see Ms. Griffin's report on difficulty completing most of her schoolwork and multiple indicators of emerging anxiety. However, based on what you tell us, Mom and Dad, and what we see here at school, all in all, I would not feel that term anxiety should have any clinical weight or concern attached to it. Please don't worry about that. I would say it is very simple anxiety linked to being in a bustling classroom environment that is just moving too fast, and she's feeling the pressure of keeping up with demands. So that's a perfectly normal response and completely in line with everything we're seeing. It's just part of being in that fast-paced environment. Then last but not least, when taking into consideration her portfolio of work samples, which we passed around the table at the last meeting, and I have here again today if anyone wants to look again through those, we see relative strengths in completing age-appropriate math problems, age-appropriate understanding of math concepts, and work such as those spelling tests and free writing of reading comprehension type question answers. Those are in the failure range. When we consider how she attempts all of her assigned work, approximately half of those assignments end up completed, and how she is socially normal, has friends, enjoys playing outside with her older brothers, listens to music, has a few computer games that she really enjoys playing, and we pair all that we know with what we just discussed from these 4 norm-referenced tests. Our multidisciplinary evaluation team feels this is all indicative of the specific learning disabilities, dyslexia, and dysgraphia. So it's very important to understand. IDEA law mandates we connect diagnoses to symptoms that are directly responsible for causing academic difficulties. We can see a clear correlation between Susie's academic difficulties in the classroom and how they match the descriptions of dyslexia and dysgraphia exactly. Dyslexia is a learning disorder that impacts how a student reads and processes language in general. It requires multiple testing types to reach a definitive conclusion, as we have done here. We see all the classic struggles with writing, spelling, and reading that come with it. Dysgraphia is also a specific learning disability that affects writing skills. While Susie does not meet the criteria for physical mechanical difficulties with writing, such as motor skills like holding the pencil properly, she does meet the criteria of tiring with writing due to the cognitive demand of it, struggles with spelling, and organizing structure and assignments. Across the board, all 4 of Susie's completed assessments support these disability categories, and this is even further supported by the additional methods that we've tried and failed, like with the MTSS. So as we consider all of this, our next step is to decide what to do with all this great information that will help us set some goals for Susie and streamline how she learns while targeting certain struggles head on. Before we go any further, Mom, Dad, Susie, anyone else have any questions about our disability categories or our test results? Okay, anyone want to share any input about that? Okay, so the first big consideration is something we call resource reading. What this would mean, it's just an option at this point, is moving forward, Susie would go to a small, different, structured class environment only for English language arts, ELAR, every day. That's 90 minutes long, just like Miss Griffin's ELAR is 90 minutes long. This would be the only time she leaves Miss Griffin's to go to a different classroom. The rest of the day would be spent in her homeroom with her classmates doing their assignments as usual. It is always a big decision to consider resource reading or resource math, which we're not considering resource math today, but those are the two that we have resource in. And it's always a big deal in considering those because it does remove a student from their core classroom environment, and also it changes what Susie learns, which is a modification. From the special educator's perspective, I can give you the pros on this. First, Susie will be in a much smaller group, typically no more than 10 students, though we can't guarantee you a class size. Receive specialized instruction that is customized according to her learning goals that we established today. And we're targeting her areas of weakness by repeatedly practicing basic, fundamental reading skills that are no longer practiced in a general third grade classroom. Like letter sound correspondence, learning about syllable types, reading leveled readers that are not at grade level, but within Susie's zone of proximal development, and working through diagnostic programs used in settings like this, such as Max Scholar, iReady Reading, which also play a role in actively gauging Susie's current performance and growth. Yes. Yeah, and we'll take more questions later too. So understandably, if you choose not to utilize resource reading, you could always go back to that option later. I know there's gonna be a lot of questions about that. But we can always go back to that option later. You can first try accommodations within Miss Griffin's ELAR classroom. Two necessary and very common accommodations for dyslexia and dysgraphia are called extended time and modified workloads. You can flip to page 2 on my handout there to follow along with our list. We'll give time and a half to double time on all reading and writing based work, especially tests in ELAR, social studies, and science. Ms. Griffin is amazing at accommodating her inclusive students using a strategy called chunking, where she divides bigger assignments into smaller tasks that proceed in a logical order and also have an extended due date put on them. She also increases her oversight in making sure that these students are getting their bigger assignments done. She's checking in on them more often. She'd be more hands-on in directly monitoring them compared to letting them proceed independently, as has been up to this point. See, Miss Griffin agrees. She has a couple students who do that in her room. Miss Griffin could also accommodate Susie by moving her desk to a more distraction-free, quieter area of the room, and during work time, but not lecture times, offer her some noise-canceling headphones to decrease distractibility while reading text or writing responses. We could even make exams oral instead of writing them for ELAR, where she sits at the back table with Miss Griffin and tells her the answers instead of writing them out. Further accommodations we can consider are putting speech-to-text software on Susie's Chromebook to allow her to speak sentence answers and writing assignment sentences out so that her direct thoughts are translated directly into writing for her and that processing demand is removed. Similar to this, in reading lengthier texts, we could also install the text-to-speech audio reader that reads aloud most text to her so that we can again cut those demands of decoding and encoding words by reading text alone. An important aspect to consider with speech-to-text and text-to-speech assistive technologies is that while they can be really powerful tools for students and they have their place, they do negate getting to the root of the problem. And for Susie, that's vocabulary, that's verbal reasoning, phonological awareness, decoding, sight word recognition. The assistive technology would be to get Susie to the meat of the comprehension, but we wouldn't be spending considerable time teaching her those concepts in the small group setting like she would get in a resource reading room with me. Going back to things we could offer Susie if she stays in the general education classroom are what we call modifications, which means to intentionally change up what Susie is learning in ELAR by either changing the leveled readers she reads decreasing the amount of questions she's expected to answer on assignments, or altogether changing what she's expected to learn as Ms. Griffin moves across topics according to the Arizona third grade standards in ELAR. You don't have to decide on resource reading or general education ELAR with accommodations and modifications today unless you're ready. But as you can see, either could be really beneficial to her, and both allow us to meet Susie where she is regarding goals like supporting in phoneme, grapheme, and sound awareness, auditory memory, phonemic awareness training, implementing use of advanced organizers for note-taking to increase her attention to at-hand tasks. Both definitely something to consider. In closing, as I've kind of peppered in throughout our discussion, we're going to go over our checklist here. We met all the IDEA law requirements by selecting the choices of disability categories, specific learning disability, dyslexia, and dysgraphia by using varied multiple formats of data connected to an academic performance impairment and not a medical diagnosis. Every multidisciplinary evaluation team member is present here today. We've all been given the information needed to reach these decisions. Everyone's input has been invited. It still can be a part because this has not been officially finalized yet. We have considered Susie holistically by evaluating total social, emotional, behavioral, academic considerations. Mom and Dad have been significant players throughout the entire process, and Susie has had both voice and choice throughout this whole process as well. So thank you all so much for being here today. We're going to go ahead, we're done with the presentation now. We're going to go ahead and have some open discussion before we finalize Susie's IEP.